Hi Anna, I just saw your picture and I just want to make a couple of comments. First of all, let's start off with the upper lid. The upper eyelid is halfway between the iris and the cornea, or maybe even more. And I also see that you're trying to raise your eyebrow. I think that your problem might be what's called eyelid ptosis, or when the eyelid comes further down than it should in your eye. There's an attempt to compensate by lifting the eyebrow to sort of keep the eye open. That might be better addressed by a procedure called a levator muscle repair rather than fan grafting to try to make the lid shorter. The levator repair will actually shorten the eyelid. Now, as far as the lower eyelid is concerned, it also appears to be a little bit too low. Now, that can sometimes happen in an older person with a loose lateral canthus, but in your case, I think you're a little bit too young for that. I think that it is more likely that you have a shallow cheekbone in the front. Some people have low volume here, and it tends to draw down a little bit the border of the lower eyelid into a semicircle. Now, a better solution for that might be fat grafting underneath the eyelid. Now, how do you know if you have a shallow cheekbone? Well, when you turn sideways and you look in either a three-way mirror or use two mirrors to see, you will notice that the globe of your eye is in front of your cheekbone. That's called a morphologic minus variant. Okay, people who have that tend to drop their lower eyelid a little bit more. In that case, a fat graft might help. Let me warn you about a lateral canthopexy. Your lateral canthus, which is this corner of the eye, is already higher than the medial canthus. That's typical of young people. And if you tighten it more, you're going to look too cat-like and too pulled over. Now, I'm not saying it can't be done, and maybe it may help you in lengthening your eyelid, but I would consult before with a serious plastic surgeon who has experience in those areas. Anyways, I hope this answer helped.